Maria Snuffer. I'm a nurse anesthetist, CRNA. A nurse anesthetist works under an anesthesiologist. So we are in the operating room the whole time with you during surgery. We're the ones that put you to sleep for surgery and keep you asleep while the surgeon's operating. We monitor all your vital signs and make sure everything's stable, and then at the end of surgery we wake you up when the surgeon's finished and take you to recovery room. The anesthesiologist has to cover, several rooms at a time, so we're the ones in there with you the whole time during the surgery. On average, in an 8-hour period, you probably do anywhere between 3 and 5 cases a day. Right, depending on if it's a longer surgery or a shorter surgery. Of course, you could do a lot more than that if you were at a different hospital setting, like a Surgicare or fast ambulatory care with shorter procedures, or if you're, longer surgeries, you might just do 1 a day if it's a complicated, surgery, or even the heart surgeries and things like that. To do this job, I feel like you have to be a really responsible person because you're really on your own a lot, making decisions that concern a patient's safety. So you have to be very autonomous, and but just get along well with others, because you have to work with others in the surgery and surgeons and your OR staff. But just being responsible, and I think, is the most important thing. A lot of times the anesthesiologist is the one that does the heart surgeries, but occasionally we will go in there, and it's the same thing where we just monitor your vital signs, keep the patients asleep during surgery, giving any kind of drugs that might increase or decrease blood pressure or whatever that they might need, but basically just to keep them relaxed and free of pain and asleep for surgery. Everybody is always very nervous about anesthesia for surgery. That's what people are mostly concerned about. It's not the operation. That's usually their biggest concern, is the anesthesia, and anesthesia is very safe. So that's challenging, just knowing that they're nervous about that, and they're really relying on you to take good care of them. I was an RN for 1 year, which is the minimum experience. You have to have a Bachelor of Science in Nursing, a minimum of 1 year experience in critical care nursing. So I was a nurse over in the ICU at General Division. And then you go back to nurse anesthesia school. It's a 27-month program. So you graduate with a certificate in nurse anesthesia after you pass your boards, and you also graduate with a master's in healthcare administration. The school is actually going to a doctorate program eventually, so they'll graduate with a doctorate in healthcare administration. Well, it's very difficult. I mean, you have to really study, and you usually cannot work full-time during the 27 months. You have a lot of classes, anesthesia, of course, and pharmacology, and chemistry and physics, and then a lot of clinical time also, where you're in the clinic working with CRNAs and doing on-the-job training, I guess you would call it. So yeah, it's hard. But if you really study, you can do it. When I was in high school, I always knew I wanted to do something in the medical field. I didn't really know what. But I just heard about this from a friend that was going into it, and I never heard of it before, and I thought that sounded interesting, and researched it a little bit more, and found out that that sounded like something that I would really like to do. Math, chemistry and physics, anatomy and physiology are really good prerequisites to go into any nursing or healthcare field. I really love my job. I wouldn't, if I had it to do over, I would still go into nurse anesthesia. Anything in healthcare, even nursing. I mean, if you want to just do nursing, there's so many fields in nursing. If you want to stay, a bachelor in nursing, then you can switch departments and do totally something different. One year work with pediatrics, the next year work in surgery, So nursing has a lot of opportunities.